Good afternoon and welcome to the University of Manitoba Alumni and Friends Virtual Learning for Life series. My name is Tracy Bowman. I'm the Director of Alumni Relations and a proud UM alumna. Before we begin, I'd like to acknowledge that the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, OG Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Thank you, all of you, for being here, for joining us today and making this part of your day. This is our fourth Virtual Learning for Life series that we've been able to offer all alumni and friends around the world since the start of the global pandemic. We've seen great interest in this program and are so glad that you're joining us, whether this is your first session or your 25th session with us. All previous sessions live on our website, so please do go to the alumni section on umanitoba.ca, and you'll be able to see all of them there on YouTube, and you can view them at any point. See as much or as little as you like of any of them. There's lots of really great content that we have to share. We're also able to offer this program free of charge to our alumni and friends thanks to the very generous sponsorship of our affinity partner, IA Financial Group. Many thanks to them. You can learn more about their insurance options that they offer alumni if you also go to the alumni website. So before we get started, just a few housekeeping details. So if you've been with us before, that you'll know all of these tips, but as you know, we're recording today's session, as I've just mentioned. So even though you're watching it live now, you're able to watch it as many times as you'd like, and we will send you a recording of today's session that you can watch, and we encourage you to share with friends, colleagues, and family all over the world. Today's format will be so that after I introduce our speakers, they'll have about 35 or 40 minutes that they will be sharing their research and sharing via PowerPoint, and we'll have two wonderful speakers for you today. And then we will be opening up to questions from you. So the only way that we can do this is we use a platform called slido.com. So that's SLIDO.com, and the password is VLFL5. And so I encourage you to open that on your website browser right now so you can get ready and start asking those questions at any point. I will monitor it in the back end, and so that way we're always looking at those questions, and we will try to get through as many as we can. But if you could please open that on your browser, either on your computer or your phone, that would be great, and you can ask away. So now I'm delighted to introduce our two speakers for today. We have three-time graduate Dr. Mariette Chartier and Leona Starr. And now let me tell you a little bit about both of them. Dr. Chartier is a senior research scientist at the Manitoba Centre for Health Policy and an assistant professor in the Department of Community Health Sciences at UM's Rady College of Medicine. And her career she's done many things, including clinical nursing, mental health research, early childhood policy development, and population health. And her research interests include prevention and early intervention programs for children and their parents, mental health promotion, child abuse and neglect, perinatal health, health risk behaviors, and the health of vulnerable populations. Now, Leona Starr, she's with us. She's a Cree woman from Thunderchild First Nation, Saskatchewan, within the Treaty 6 territory. She works as the Director of Research for the First Nations Health and Social Secretariat of Manitoba. Leona is part of the Manitoba First Nations Pandemic Response Coordination Team, which is doing very important work in ensuring that COVID-19 data and vaccine reporting is adequate and provides information for First Nations in Manitoba. She's also worked collaboratively with locally, regionally, and nationally to ensure research and information is governed according to protocols defined by First Nations. So with that, I'm going to turn it over to Mariette and Leona.
Thank you. Let me share my slides. So thank you everyone for being there. So the name of our presentation today is Our Children, Our Future, the Health and Well-Being of First Nations Children in Manitoba. Well, thank you very much, Tracy, for acknowledging the traditional territories. And I'd just like to say that for me, as a research scientist, it was really important for me to be part of reconciliation, and working on this study with our First Nations partners was a small step towards that. I'd also just want to acknowledge our project team. There's many people that Leona and I will be sharing it today, but many people were behind this work. So there are people from the First Nations Health and Social Secretariat of Manitoba and the Manitoba First Nations Education Resource Center, and researchers and staff from the Manitoba Center for Health Policy. So Leona, I will give it over to you.
Thank you for that introduction. I just want to introduce myself in my spiritual name, Dansa Skitapiasuskwo, Maingindodem. Good afternoon, everybody. My name is Leona Starr, and I'm really honored to be able to present and sit here with you today to present on the well-being of our children. And I just first want to start off with just really recognizing that as First Nations, we've always been sovereign nations. We've always had our oral teachings, our origin stories that have always taught us that we originate from the stars when we're born. Our children are gifted to us. They're loaned to us. They're not ours. They're ours. They're our responsibility to take care of. And once their journey is done, they also, our children as well as us, we all return back home to those stars. And within that system, within that traditional system, we've always had our own laws and our systems that have always governed and supported the well-being of our people. We've had our own medicines, our own healers. We've been tied to our family through kinship ties, through our clan systems, and our ongoing roles and responsibilities as we relate to the plants, animals, lands, and waters. Next slide, Mariette. And just to take a step back as well, as sovereign nations, we also entered into treaty agreements with the Crown. And it was an agreement to share the land in exchange for territories, which we now call reserves, although they were predefined by negotiators, and also the ongoing payments of annual treaty payments since the signing of those treaties that ensured that we're able to continue to hunt, trap, gather, and fish. And we also had that right to educate our own children in our own way. And most significantly is the treaty right to health, which was negotiated within the Treaty 6 negotiations. We often refer to it as the medicine chest clause. And these treaties that were signed between the years of 1871 and 1921, they were to survive for as long as the sun shines, the grass grows, and the rivers flow. Next slide. In addition to those treaties that were signed, there was also as a result of those treaties, there's certain rights as Aboriginal people that were enshrined within the Canadian Constitution of 1982. There was the establishment of the Indian Act, which was implemented in 1876, which unfortunately has really led to the ongoing colonial and systematic policies that have continued to control and assimilate the lives of First Nations and Inuit people since the implementation of that act. And that act continues to exist today. And you'll hear more of the implications of this act as we go through some of the findings. And it's important to note within Section 35 of the Canadian Constitution that the existing treaty and Aboriginal rights of Aboriginal peoples within Canada are recognized and affirmed. And it also states that the federal government has the responsibility for Indigenous people and the lands reserved for us. Next slide. So one of the implications of the Indian Act was the creation of the Indian residential schools, this era that essentially apprehended 150,000 First Nations, Inuit, and Métis children, effectively removing them from their homelands, from their families, from their kinship lines, and their ties to their territories. And the goal of those schools was not to educate the children. It was essentially to kill that part of us, that Indian, in order to effectively assimilate them into the Canadian construct. And during that time, the children and the families experienced many types of abuse, from spiritual, emotional, physical, sexual abuse. And one of the most devastating impacts of this era was the impacts on the disconnect to their language and our ability to pass on those teachings around the culture and those traditional practices, and essentially attempting to sever that tie, that sacred bond between parents and families and their children. In addition to that, there's ongoing experimentation that was allowed to occur without the consent of parents and families. Next slide. When we talk about the treaty right to health, during the establishment of the tuberculosis sanatoriums across Canada, it was really, as First Nations, we thought about it in the context that, yes, they're honoring that treaty right to health. But on the government's perspective, based on recommendations flowing from their physicians and their experts around what wellness means, how systems can actually help support First Nations. It wasn't necessarily to help the well-being, it's really to contain illness within reserved territories. So therefore they established these TB sanatoriums, or Indian hospitals as they were called during that time. And this was an ongoing apprehension, again, of children and families being sent away for treatment, and many individuals did not return home to their families, or children were sent without actually knowing their origins. And again, the ongoing unsanctioned experimentation without consent continued even after the Indian residential school era. Next slide. We also refer to the stolen generation of First Nations children. During this time between the 1950s and the 1980s, about 20,000 Aboriginal children were apprehended and placed within foster care systems, far away from their territories, not knowing where their families were or how to actually connect back with them. And they were sent as far off into the United States, as far off as Western Europe. Next slide. So this is like giving you a bit of context into why we're seeing the results that we're going to be sharing today. And it didn't happen within a short time frame. These were long-lasting legacies as a result of the impacts of colonization, impacts of residential school, and racist policies that were imposed upon our distinct nations. Within our research, we particularly focused on First Nations within Manitoba. not on Inuit, not on Métis. Because as First Nations, we are a distinct group, even within the Canadian Constitution. We have very distinct nations. Within Manitoba, we have 5 distinct nations of First Nations. We have the Dene, the Oji-Cree, the Cree or Nehewak or Anishinaabe or Ojibwe, and the Dakota people. And still to this day, about 60% of our relatives continue to live within their territories. Next slide. So a bit of background in terms of the partnership that we formed. Our organization was previously a part of the Assembly of Manitoba Chiefs, and the mandate of the Assembly of Manitoba Chiefs was really to protect and strengthen those inherent rights and those treaty rights to essentially support and improve the well-being and socioeconomic conditions of First Nations people within their nations. In 2014, our organization received the mandate to incorporate as a standalone entity outside of the Assembly of Manitoba Chiefs. And that happened around the time of Idle No More as well. I'm sure a lot of you are quite familiar with what had occurred during that time, but the chiefs within Manitoba actually identified the need to protect health funding, because AMC at the time was one of the strongest advocates across the country. And during that time, under the Harper regime, the budget for the Assembly of Manitoba Chiefs was cut by 80% based on their effective advocacy. So to really address the need to protect health funding, they knew the importance of health funding, so they mandated the Research and Health Department of AMC to move out and incorporate under a standalone entity. So since then, we've been operating under the First Nations Health and Social Secretariat of Manitoba, similar to the mandate that was provided to the Manitoba Education Resource Center, who's also a partner in this research project. Next slide. So when we started discussing the opportunities to look at First Nations well-being within Manitoba, we want to, one, address a few areas. We want to actually ensure that we're getting the story right. We want to ensure accuracy of data to really inform the planning and decision-making efforts of communities, and also to ensure that there's future comparisons by ensuring that there's ongoing annual reports to measure based on the baseline report that we're presenting today. Next slide. And also in answering this call number 19 of the Truth and Reconciliation calls to action. Call number 19 actually calls for annual regular reports that really measure the gaps in health outcomes as it relates between Aboriginal and non-Aboriginal communities. When we looked at the entire 94 calls to action, we know that each of those calls actually cross-cut numerous calls when we look at children and how those calls to action actually really outline effective ways to address the harms and of the legacy of the Indian residential school era, including the TB sanatoriums, including the stolen generations, and the ongoing apprehension of children by the current CFS system that we see today. Manitoba is we actually have the highest rates of Indigenous children who have been apprehended by the current CFS system and continues today. So what we want to demonstrate is that, one, we needed regular annual reports, but we also needed to ensure that the story was actually told from an Indigenous lens, a First Nations lens, specifically outside of Métis and Inuit, because when we start reporting numbers, when we hide the uniqueness of First Nations, Métis, and Inuit people by lumping us all in under the term Indigenous, it really does ignore the realities and the jurisdictional challenges that each of the distinct nations face and live on an ongoing basis. Next slide. So is this me or is this you?
It's you, Leona.
Okay. So when we started this project, this research project, or this research relationship, I want to call it a relationship because it really goes beyond the course of the intended timeframes. Because I've known Mariette for quite some time, and I've built a really strong relationship with her and the center overall. And what this study really demonstrated and upheld is the First Nations data sovereignty piece. Because the way this report was done, there was a lot of work in the forefront, in the back end, to actually get it to where we're able to present to you today. We talked about entering into information sharing agreements so that we're actually able to assert the First Nations principles of OCAP to ensure that First Nations had ownership, control, access, and possession of their own data, of their own stories, essentially. And our entire research process and the data that we actually came to look at was also guided by and interpreted by our knowledge keepers throughout that process. We also went to our First Nations Research Ethics Board, first and foremost, the Health Information Research Governance Committee, who also asserted First Nations data sovereignty since the 1990s. So this project actually was approved by our First Nations REB from the onset, and it continues to be supported by our knowledge keepers and our partners to be able to share these results in a thoughtful way and really from our lens and perspective. Next slide. So again, our team was guided by knowledge keepers throughout the process, and sometimes it shifted our focus based on the analysis that we were presenting, and we asked them how they wanted to actually see the results in terms of which variables we're looking at, and we shifted a few times, and we always went back to them to check in to validate, like, okay, is this what you're seeing, or how do we further look at this to really draw out, highlight what the effects of the ongoing colonization that our children live in. And unfortunately, this is not going to be a good news story. It really does show the gaps in First Nations children well-being in comparison to all other Manitobans. Next slide. And we wanted to actually share this First Nations mental wellness continuum framework that was developed by First Nations in partnership with the Assembly of First Nations, as well as members of FNHSSM and multiple mental health and wellness experts. What's really important to draw from this framework is these 4 aspects of ensuring the well-being around the purpose, to ensure that our children are born, are supported in such a way to eventually fulfill that purpose. As children are born, we're all born with a purpose. And it's our role and responsibility as parents to help foster and support them to fulfill that purpose throughout their lifetime. And also to ensure that there's meaning, it's meaningful, and to ensure that they have that belonging that's supported by having that connection to who they are, to the lands and waters, to their culture, to their language, and to always instill that hope. Next slide.
Leona, maybe I will just take it from here for a little while. So thank you very much for giving us that background. It's so important. We look at the results to really keep that in mind. I just want to say a word before I do delve into a little bit about the methods and the results. Is as a non-Indigenous researcher, how we develop together a space to be able to work together. And, we did explore, as, Leona just showed, to understand the history of First Nations people in Manitoba, their values, their teachings, culture, language, the legacy of residential schools, hospitalization, the relationship to the land, the holistic approach. And also knowing that we approach the data and the research, based on the way we were taught, right? Paying attention to methodology, the scientific method, theories, research ethics, understanding bias, fidelity, all those. But in the middle, we met together in a spirit of openness and reciprocity, making sure that the research will benefit First Nations peoples in Manitoba. We built mutual respect. We understood the cultural protocols and learned of them and practiced them, in this research. Communication was key, as was building trust within each other and relationship building. And I think this took a lot of work from all members of the research team, but I think it was well worth the effort. I work at the Manitoba Centre for Health Policy, and it houses population health research data. The report that we'll be showing and the results that we're showing today are based on administrative data. So they're data that are used when someone visits a doctor or a hospital. This data is kept. And it's all de-identified, so you don't know who's who, but it's very useful to be able to look at different aspects of people's lives. So we also have justice in those data, that data repository, education, social services, and recently working with First Nations Health and Social Secretariat of Manitoba. In the data repository, there's the Manitoba First Nations research file that can be accessed with all the permissions that Leona talked about. And that's how we were able to really develop our group of First Nations children that we studied. So First Nations children and adolescents are those with status, those from the registry that are, within the file, as Leona had mentioned. And their ages 0 to 19. And as a reference group, we had all other Manitoba children. And so this group does include non-status First Nations, Métis, and all other children in Manitoba. So who was in this report? Well, First Nations children make up 18% of Manitoba's child population, so 61,700. About 2/3 of them, 40,000, live on reserve, and another third, 21,000, living off reserve. And then all other children in Manitoba, there was about 280,000. So that just gives you an idea of who's included in this study. Some indicators that we looked at, as Leona talked about, the First Nations wellness framework has so many indicators or aspects to it. And as we know, many things influence child health. So we wanted to look at as many indicators as possible. There's about 45 or so. There's birth outcomes, physical health, mental health from the health data. There's family services, social services, education data, justice data, justice involvement, and healthcare indicators. Because First Nations families and children access some of their healthcare through the Manitoba Provincial Health System, we wanted to look at the indicators by health regions. So there's 5 in Manitoba. Here they are on the map. And this is, don't be scared, I'll walk you through this. This is a graph of what you'll find in the report when we looked at the indicators by health region. So hospitalization is an important one because normally children are quite healthy. When they're hospitalized, it means that they're very unwell. And so it tells us a lot about the health of the population of First Nations children. All of these are the health regions, and at the bottom is the overall Manitoba rate. So the first bar are First Nations living on reserve. The second one are First children living off reserve. The one beneath it are both groups together, and then the very last one at the bottom here are all other Manitoba children. And what you can deduct by looking at this graph is across all regions, First Nations children had higher hospitalization rates. There was actually no difference between on and off reserve, even if it does look like it in the graph. And there was no differences across the health regions. These are the birth indicators that we looked at. So preterm births, small or large for gestational age, breastfeeding and hospital discharge, teenage pregnancies and births, and newborn readmissions. In this column, it's both First Nations children living on and off reserve. Those are the rates. And these are all other Manitoba children. And if you just scan across, you see that the rates show that First Nations children have poorer birth outcomes than all other Manitobans. And you can see why it was important that Leona shared the context. It really does help explain these differences. The knowledge keepers and First Nations service providers and First Nations people told us it was really important to look at the indicators by the Manitoba Tribal Council areas because the health services are organized by these council areas. Some First Nations are independent and aren't affiliated to a tribal council area, but many are, and here they are on the map shown here. And this is what it looks like when it's not a graph. So this is a graph of breastfeeding crude rates on and off First Nations by tribal council areas. And these are percentages. And for the years 2013, 12-13 to 16-17, so 5 years. We see when you look, there seems to be differences across the tribal council areas, which is important because it helps in sharing that information. So for instance, if I go to Independent North, they're the ones who had the highest breastfeeding rates, 63% on reserve and 79% off reserve. And it shows that there are ways of increasing breastfeeding rates, which we know is so important for children. We looked at where First Nations women were giving birth. Nearly 1/3 of First Nations women, those living on reserve, had no year-round access to services to assist in giving birth, which is very important to know because, of course, if you can't give birth in your community, you need to travel. You're away from your supports, from your community, and often a month before giving birth. So it does help explain those birth outcome indicators. We looked at physical health indicators, and here's the list. So going from asthma, diabetes, dental surgeries for tooth caries, lung infections. This is for ear infections, eczema, essentially, and developmental disorders such as autism or Down syndrome. And again, almost all the indicators show that First Nations children have more higher rates of physical health problems. The rate, this really struck us. So the rate of dental surgeries was 28 times higher for First Nations children than when we compare them to all other children in Manitoba. And I just want to bring home that these are children 0 to 6. So these are dental surgeries that need, the teeth were in such bad shape they needed surgery. And it really does point to the need for, better diet and good dental services for children. The other way that we showed the indicators, and here's an example. So this is the prevalence of diabetes for First Nations children living on and off reserve. And we wanted to show it this way because often the disparity between First Nations and non-First Nations is explained by income, by the fact that there's differences in income. And that certainly is part of the reason. But as we see in this map, or this graph, pardon me, at the top here are First Nations rates of diabetes, extremely high. And then here at the bottom are all other Manitoba children. And we know that those in living in areas of lowest income quintiles have higher rates of diabetes, but still they're still a lot lower than First Nations children. So First Nations children have higher diabetes rates than all other children, even those living in the lowest income quintiles and the highest income quintiles. Here we looked at mental health indicators as well. We looked at these different types of mental health problems. By and large, it shows that First Nations children and adolescents have a high degree of mental distress. We were surprised to see that the diagnosis of mood and anxiety disorders looks about the same, and it really contradicts what we see at the bottom of the table, where suicide attempts, hospitalizations for suicide attempts, and deaths by suicide are terribly high. And the fact that the youth are not being diagnosed with mood and anxiety disorders tells us that there's an emergent need for mental health promotion and mental health services for First Nations children. We looked at education indicators, and I won't go into a lot of detail, but First Nations students are nearly twice as likely not to complete high school. Also, First Nations students are nearly twice as likely to be disengaged from school by grade 7. And I just want to, I'm glad that Leona talked a lot about the background of residential schools. I did visit Wesqueesy Peak First Nations for a mental health promotion project that I'm working with Swampy Cree Tribal Council communities. The first time I went to Wesqueesy Peak, I couldn't find the school. I was driving around trying to find it, and this was the school. I couldn't believe it. I didn't sleep that night. This was in 2016. And I'm going to show you this. This is 5 years later. There was some funding for a new school. The federal government has said that they would increase funding to First Nations schools, and here is some of the results of that funding. So this is Chief Charles Oddie Memorial School in Wesqueesy Peak First Nations. So the youth and community is thrilled. So these are the kinds of things that need to be done to improve First Nations education indicators. Social services, here are the indicators that we looked at. Again, First Nations are using more services than all other Manitobans. And Leona talked about this. This was very disheartening to see. It wasn't a surprise, but nearly 7 times as many First Nations children are taken into the child welfare system compared to other Manitoba children, and for all the reasons that Leona talked about. The justice system, we were able to look at youth accused of a crime, children and youth who are victims and witness a crime. These are percentages. And again, the rates are higher among First Nations children. First Nations children are 6 times as likely to be a victim of a crime. So in summary, I didn't show all the results, but it gives you an idea. There's large disparities between First Nations children and all other children in Manitoba. First Nations children living off reserve fared a little better than those living on reserve. Some limitations of the data included, as I showed you with the mood and anxiety disorder result, we're suspecting there's either underreporting of the true prevalence of depression and anxiety among youth due to poor access to health services. And to be able to discuss this a little bit more, I'll ask Leona to speak to these results.
Thanks for that, Mariette. As I stated earlier, the results were very concerning, but they also weren't surprising. Looking at the well-being of our children and looking at the various factors that have impacted their overall rights as a child due to those ongoing interruptions due to colonization and interruptions that effectively aim to assimilate our children into a way of life that isn't their own. So when we talk about the rights of our children that every child is born with, every single child has a right to their name, their traditional name. When I first introduced myself, I introduced myself in my traditional name. And there's certain roles and responsibilities that also come with that name that every child has a right to know. We also have rights to our clan, to identify what our different clan systems are and our kinship ties to those clans, and our roles and responsibilities within those clans. We also have a right, our children have rights to their families, to grow up with their families, being connected to their families. They have a right to their culture and ceremonies, to be able to practice, to know where they come from and what roles and responsibilities they have in our lodges. They have a right to their identity, to who they are as distinct Nehewak or Anishinaabe or Dene or Dakota children. They also have the right to be able to speak their language, to learn their language in the same way that French is recognized and supported and funded equitably within public school systems. We have the right to support our children in knowing their language and learning their language within these school systems. They also have the right to fulfill their purpose. As I stated earlier, we've all been brought down to this earth with a purpose, and our entire life goal is to do everything along our journey to fulfill that purpose and our roles and responsibility to that child to fulfill their purpose within this realm. They have a right to their ancestral lands and territories, to know those lands and waters and the healing that is derived from them. They also have a right to know the lifestyle of their people, their history, the history of their people, and the strengths that have been passed on through those intergenerational ties, not only of trauma, but intergenerational ties of love. For without that love, we would not be here. Our children have a right to their education in such a way that they're supported to be who they are as Nehewak, as Anishinaabe. not only within a public school system, but to an education frame or education space that really recognizes our relationship to the lands and territories, and to know the medicines and to know those songs that we also render within our lodges and ceremonies. And they have a right to be protected within and from outside forces upon them. And as parents and families and communities, we all have a duty and responsibility to ensure that these rights are fully protected, so that our children enjoy the life that they were given, and the life that we were loaned as parents to take care of. Next slide. I'm not going to go through each and every one of these, but I just want to give you a snapshot of what our knowledge keeper, Catherine Whitecloud, had prepared for us. In writing this report, she talked about these numerous acts, these numerous interruptions that have been put in place to essentially attempts to sever that tie, that sacred bond that we have within our families, within our kin. Next slide. And as I mentioned before, the era of the residential school was not an effort to educate our children. It was a fully sanctioned legal attempt to essentially kill the Indian within their children, to kill that way of life within our children. And through those ongoing colonial acts, it continues to this day, where we see that systematic racism, the ongoing forced relocation, the imposed poverty, the cultural dislocation and dispossession, the colonization, those acts of genocide and oppression and institutional abuse that occurs and continues to occur within our education, justice, and child welfare, and within governments themselves. And when we look at the indicators that we've shown you today, these are all negative social determinants of health that have really resulted in the negative state of the well-being of our children today. Next slide. When we look at what we heard from our knowledge keepers after we finished the report, we did the analysis, we went back and forth in terms of adjusting and adapting to their recommendations. What we were told, based on the results that we shared, that it was that first sacred bond of family that was interrupted and compromised right from birth, and has resulted in the medical conditions or the challenges that you see within this report. And as a result of the lifestyle that is so foreign to our people. And what we've been told, and we've always been told, and I'm sure within the circles that you may sit with your Indigenous relatives, that for us to ensure the wellness of our people, that we must return to the land, we must return to our natural diets, we must reconnect our spirit to ensure that we continue on a journey that essentially fulfills our life's purpose. And our children must be taught our own sacred laws and natural laws that have always sustained us and our well-being until such time that colonization has effectively interrupted that transfer. And that education and lifelong learning starts at the home. We need to create a healthy home base in order to support the well-being of our children. Next slide. And one way that we've identified to effectively address and support wellness of our children is to repair that sacredness that was severed or interrupted. I'll never say it's severed, because it's always going to be there. It's always there. We just have to pick it up again. And it's the return of our children back to our families, and that in a way that is fully supported and resourced to ensure the welcoming of our children back home within our families and territories, and to ensure that the support is provided all the way from prenatal all throughout the life stages into as they go into their next lifespan in terms of adulthood, and that they're to ensure that the women are surrounding them throughout each of those life changes as grandmothers and aunties and mothers, because we each hold like a very specific role and responsibility in the upbringing of that child, and to ensure that those ceremonies are instilled and supported to really celebrate and mark those direct passages through those life stages as they transition from children to adolescence to adulthood. Next slide. I think this is you, Mariette.
Okay. We wrote many recommendations, and we just thought we'd put a few of them on the slide. But to be able to address this disparity, it'd be important to implement the Truth and Reconciliation Commission calls to action, all of them really. But number 19 just talks about being able to just continue to track these indicators and make sure that we're seeing some progress. The importance to continue to partner with First Nations leaders and researchers. Leona really brought this point home, that it's important to bring First Nations children home to their culture, to their language, and to keep them in their homes. Of course, what we saw is that it was hard to measure, but there's the patterns of what we saw suggested that there was not equitable access to equitable services. When we talked to the knowledge keepers, confirm that. So it's important to ensure this. And Leona talked a lot about this as well, reconnecting children to their land, language, ceremonies, in ancestral ways. I'm just thinking of the time. We wanted to show a few programs that talked about some really important work that's occurring all over Manitoba that is addressing some of the disparities that we've seen. But I'm wondering if, Leona, what do you think? In the interest of time, should we maybe just name them and then?
Yeah, that's fine. Yeah,
yeah.
Go ahead.
So, one very important program is called Restoring the Sacred Bond Initiative. So we will let you check that out on the website. Community-based primary health care. I won't say anything about that, but please check that out. Strengthening families, home visiting services to families living on reserve. That's on the website as well. And the Manitoba First Nations school system, the first of its kind in Canada. I'd invite you to check out that website as well as promising initiatives. There's many others, but we wanted to share a few with you. And I thought, Leona, I'd give you the honors of giving a few concluding remarks before we go to the questions.
I think one thing I just want to leave you with is that each one of those promising initiatives that we've shared towards the end, I do hope you go online and like really learn more about them. But what's really unique about each and every one of them, that it's all been First Nations led. These are all initiatives where the initiative is being implemented. It's being supported by First Nations themselves. And it's really going back to restoring that sacredness of that relationship that we all hold with our children, and that responsibility that we have not only to our own children, but those children coming after us. And that's it. Thank you.
We're all receiving an emergency alert, I think, at the same time right now. I'm going to look at that in a moment. But thank you so much, Leona, Mariette. That was moving, really important work. And we do have some questions that have come through, and we don't have a lot of time. And so I'm wondering if, before I move to those questions, can you remind us again, what is the best website, or which websites, because there's a number of reports you mentioned, where is it our viewers should be going to learn more? If you could just remind us again, where is it we should be going?
Did you mean like the report itself, where it's found?
Yes, the report itself, yeah.
I could, if you just Google Manitoba Center for Health Policy, it comes up right away.
For health policy, okay.
Manitoba Center for Health Policy.
It's also on our website at www.fnhsssm.com, and you can also find reference to a lot of the MCH, the Sacred Babies initiative as well. So there's a lot of supports there that are actually being led by First Nations people in terms of supporting the wellness of children and families.
Okay, and then those 3 reports that you were mentioning that you didn't have a chance to go into that detail, would we also be able to find that on that same website?
Yeah, you can find more information on the community-based primary healthcare initiative, which is also referred to as IFIT, and then maternal child health. There's also links to the Sacred Bond initiative.
Okay, super great. Okay, so that addressed one of the questions that came up quite quickly, which is, where can we get a copy of the report? So I'm glad we know where to go. So Kristen, Teddy, if I could just ask you to bring up the slide, as there's 3 questions, if you're able to. I don't know if you can make it a bit bigger on the screen so we can all see it. I'm hoping we can get through all 3 of these questions. So the first one being, were there any conclusions with regards to causal factors, especially those that may lead to recommendations for how these disparities can be addressed?
Do you want me to address that, Leona, or start, or do you want to?
Okay, you start. I'll fill in the gaps.
We did check with Dr. Bob Schwartz, who has been looking at this quite a bit. He's the one who helped us come up with that definition. It's been known for quite a while, actually, that there is a major health concern of oral health among First Nations children. It's probably diet and lack of dental services. But that's about as much as I can really say. Leona, can you have something to add to that?
I think it also has to do with the high cost of food, especially in the north. When you look at the equivalent of the options to buy a sugary drink versus milk, or looking at a diet that's more traditional and holistic, that actually supports the overall well-being of our distinct nations, like going back to a traditional diet. Because when I look at, you go into any grocery store, you don't see yourselves in the food store or in any type of grocery store, even looking at the rates of diabetes within First Nations children, where the numbers are really stark in terms of the outcomes of diabetes amongst First Nations. But when you look at the actual content of food and what our children are eating, and it's like such a heavy content of carbs, something that is such a foreign food source, like to our natural bodies and our natural diets.
Mm-hmm. Yeah, no, a very, very good point. Yeah, access and cost is something that we don't always think about. So yeah, thank you for that. Chris and Teddy, if I could ask you to bring the final two questions up, which is, okay, so there's many thought-provoking stats here. 28 times the dental surgeries is a new and an old one. Was this explored more? It's new and an odd one, sorry. Was this one explored more?
It really wasn't. The goal of this report was to provide a snapshot of where we were in 2016-17 when we had the data. I do know, though, and I don't know if Leona, you're doing work with Dr. Robert Schwartz, but he's a dentist who's been working with First Nations communities on this. But we didn't explore it more, but I know there is some work being done.
I think the intent of this report was to provide that baseline. And then if we could partner with other allies and colleagues to really delve further into each of the different areas, that's something that we would consider to really address and bring further recommendations on like how to really address those huge gaps that we're seeing in almost every single area.
Okay, thank you. And the last question is there anything non-Indigenous people can do who are upset by what they have learned, or should we just get out of the way?
That's where you need a bit of both. Sometimes when we're in certain positions or certain policy areas, when we look back at the original signings of the treaty, when we look back at certain policies that have been created to actually support the laws and legislations of this country, yet within our home territories, we're probably the most disadvantaged population when there's an agreement to share. That agreement wasn't necessarily honored by people sitting within certain positions that really follow policies to a T, or it's left to the interpretation of individuals sitting within those positions to support the treaty right to health, or to actually put limitations on what's allowable and available in terms of educational supports and what education and indicators are actually looked at and supported and funded and effectively resourced. When we look at kind of flipping the tables and just like really allowing for that, not even allowing, but just creating space to step out of the way to for First Nations to actually be sovereign, to be self-determining, because in each of our different initiatives, it wasn't answering the call out for a specific grant, what the government thought that, okay, this is how you're going to address diabetes. But it always came back to that foundational support of how do you support reconnecting back to the land, the waters, the language, and really that foundation of supporting culture from the onset. And it's not necessarily about investing more money in research. It's about applying, supporting that research into action. Because we know that these gaps have existed. We're just sharing it or really highlighting it. And what we want to do is to measure whether or not, how much longer are we going to stand by and fail our children? How much longer are you able to be in your positions or know of people who are in their positions that are continuing to allow this to continue? The continued apprehension of our children should not continue. We need our children back home. We actually need to support our families and our well-being, but from our own self-determining thought and assertion of sovereignty in all aspects.
Thank you for that, and thank you for your honesty and your candor on that, especially when it comes to people who are non-Indigenous like myself, who are very troubled by what we're seeing and what we're reading. And, you know, what is it we can do, right? What is it, what's our role? Because there is a role for everyone, and just what is it we can do? So thank you for that. And thank you to both of you for that really amazing presentation. Chris and Teddy, can you just put that website back up again, just for all of our viewers so they can get access to report and find out more information? That's the FN. Perfect. Great. Thank you so much for that. So I really encourage you to go to that website to learn more. It is a really important way for us to make sure these things are not happening again, and all the things that Mariette and Leona have said don't repeat themselves. So I encourage you to go to that website and read more and reach out and do that. So we will be sending you the link for today's session, so you can view it again, as I said, and you can share it with friends, family, and colleagues. There's a lot of important information that was shared today. We will also be, like usual, we will be sending you a very short feedback survey just to get your thoughts, also on possible other topics, speakers, all those sorts of things. Please do respond. It's the only way that we are able to improve with each session. And I just wanted to let you know about next week's session if you haven't registered for it yet. Next week, we will be joined by Dr. Megan Sinclair, who will be speaking on the topic, Where Reconciliation Lives. He's an assistant professor here at the University of Manitoba. He's also a regular media commentator on CTV, CBC, APTN, and the Winnipeg Free Press. And in fact, he's got an opinion piece in today's Winnipeg Free Press titled First Nations-Led Success in Community COVID Fight. So again, thank you very much to everybody for joining us. Thank you, Leona. Thank you, Mariette, for that wonderful presentation. And thank you to all of you for joining us. We will see you next week.